Well, I think the important thing is to actually ask how much information they want. Sometimes you can have some view about what cultural group they might have come from, but even within our own families, we have our own cultural view about who deals with some information. And so if you're uncertain, and most of us are as medical practitioners, you're only a temporary guest of this family, if you like, you have to ask, are you the sort of person who wants me to go into lots of detail? Should I be talking to you? Is there somebody else I should talk about? Do you want me to talk in general terms, or would you like me to be quite specific? And then I think it's always important to talk about the uncertainties that there are, as well as the known things. I think a very useful strategy is to plan for the worst and hope for the best, because none of us can know what is around the corner exactly. There are some people where medical knowledge will suggest that there is a limited time and that it might only be weeks or short months, but we know that doctors generally are very poor at judging those things. Positivism isn't necessarily everything. I think most people would want some hope, and it would be terrible to be accused of having taken away somebody's hope. But hope changes over time. I think that the right thing is honest communication, but we also need to have systems that provide real support so that people have good pain control, that they have physical care when they need it, that it can happen in their homes, not only just in hospitals. So that's a whole of system issue. But for doctors, you need to be able to offer realistic comments about what you're asked, to be honest. Many people think that we know everything and we're just keeping information from them rather than explaining what things can be known now, what might be known at some time, or what might never be known. I think the important thing is to listen and talk to them about how they feel about what's going on, to make sure that you have the best skills about knowing about pain relief, or if you don't have them, knowing where you can find somebody within the medical profession who can help you.